Hi, I'm Luke Ramsey. I'm a chiropractor with 32 years experience, and more often I'm seeing patients with herniated discs. A herniated disc is when the central nucleus leaks out through the outlet part and pinches a nerve. So, what are the symptoms of a herniated disc? More often than not, a herniated disc will of course cause severe back pain. And another common symptom is pain in the leg, commonly called sciatica. So you can have pain in the bottom, pain in the back of the leg, pain in the calf, sometimes all three areas, sometimes accompanied by pins and needles in the toes. More often than not, when you cough or sneeze, you'll have severe pain. You'll find it difficult to get a position to rest. Sitting, standing, walking around, even in bed can sometimes be uncomfortable. Herniated disc can cause other symptoms as well, like numbness, as if somebody's put a block of ice on your foot and you can't quite feel your toes. And when a herniated disc is severe, you can even have weakness so that you can't control the movement of your foot. Thankfully this is more rare, but it is a sign that your disc herniation is quite bad. Other symptoms include pins and needles, either in the back of the leg or the foot, and more severe discs can cause weakness so that when you walk your foot slaps down. Thankfully this is less common, but it's a sign that the disc herniation is really quite bad. Less common symptoms include pain in the leg intermittently, but you don't feel such severe symptoms, you might think it's not a disc. Other things can be the nerves affect the veins and the arteries, so that your leg might be a slightly different colour from the other one. So, this is a model of a two vertebrae with the discs. So you have 5 lumbar vertebrae. This part here is the part at the back, and your discs are approximately in the middle of your body. The discs aren't really in your back, they're more in the centre like a column. So the discs consist of cartilage on the outside, and the inside there's something called the nucleus pulposus, which is like a gel bag under pressure. So what happens when something goes wrong is the disc on the outside cracks or fractures, the part called the annulus fibrosus, and the gel in the middle extrudes out and presses on the nerve, causing symptoms like leg pain, numbness, pins and needles. Here are 2 pictures of a magnetic resonance scan, one from the side and one from the top, a so-called axial scan, and you can see the disc herniation clearly. Normally in human beings the disc should be quite full and quite turgid, and disc problems, disc herniations aren't a problem when you get older. They can be a problem in young people because of the fact that the centre part is still full. So 80% of discs, when they herniate or bulge, they bulge towards one side. That's called a lateral disc bulge. And when you have a lateral disc bulge, you would normally have symptoms in one leg and your body leans away from that leg, away from the pain. So for example, if you have right leg sciatica and you find you're leaning to the left and it's hard to straighten up to the right, you have a lateral disc bulge and your prognosis is good with conservative treatment. So less common is what's called a medial disc bulge, where the disc bulges medial to the nerve, and the symptoms of this will be different in that, suppose you had right leg sciatica, this time you would lean towards that side, and leaning away from it would be more painful. Medial disc bulges have a prognosis which is less good. They're more difficult to treat conservatively, but not impossible. So much less common, thankfully, is a central disc bulge. And people with a central disc bulge quite often have severe flexion, so they're bent forwards, they can't stand up. And instead of pain down one leg, they more often than not have pain down both legs. And the prognosis of conservative treatment for a central disc bulge is not very good, and the majority would end up having surgery. So, what are the treatment options for a herniated disc? In this clinic, we use something called flexion distraction, where the disc space is separated by a machine or manually to decompress it. Another treatment option is where we use blocks. It's a technique called sacro-occipital technique, and I'll explain this later. And the third option is manipulation. But manipulation, in my opinion, is only indicated when it's a case of a posterolateral disc. So the disc has gone lateral, and thankfully that's 80% of the discs that come into our clinic. So in flexion distraction, the table moves up and down, and I would hold the back of the vertebra above the disc that's involved, and what this does, it opens up the disc base and decompresses the nerve. So using the blocks, which is part of sacro-occipital technique, the blocks are so positioned as to open up the space. Quite often the patient will have immediate relief if you put the blocks in the right position. And to relieve pain in the leg, part of the protocol is to pull the leg. So for example, if the pain was in this leg, the sciatic pain was coming down, pulling the leg helps relieve the pain. Also, you can get an assistant to pull the leg while you lift the vertebra to decompress it. So if manipulation is indicated, and it isn't always of course, then the technique we use in this clinic is the leg is placed between my legs, so that means I can't do a twist. So there's no twist involved. The back is kept flat and straight. And the treatment involves, again, lifting the disc with the fingers in a pumping action. There are other factors that can affect herniated discs, just as other factors can affect any health problem. One of those is that you might have to make some lifestyle changes. So those lifestyle changes are, you probably have to drink more water, dehydration. The second one is that, like everybody, you should try and eat 5 a day. Eat more fruit and vegetables, less sugar, less caffeine. And the third one is stress. Chronic stress definitely affects herniated discs. When you're chronically stressed, your body makes a hormone called cortisol. And cortisol slows down healing and definitely affects tendons, ligaments and nerves. Supplements that may help, that I recommend, include Lavi Basic. Lavi Basic has minerals like calcium and magnesium and a blue-green algae called chlorella. And what this does, it makes your system more alkaline. When your body's too acid, it can't heal. And the chemistry, the biochemistry for healing is interfered with. The modern diet with high protein, not enough fibre, not enough greens, quite often is acidic. Coffee makes you acidic, alcohol makes you acidic. And what this supplement does is balance your pH and promote healing. I also recommend this collagen supplement. It's collagen, high hyaluronic acid and vitamin C, all of which help heal discs. They help heal the cartilage part on the outside by giving your body the raw materials to work with. And this supplement gives you a dose of 10 grams of collagen, which is quite high. You'd have to take an awful lot of pills to do that, but this is in a powder form. I've been Luke Ramsey. Thanks for watching. I hope you found it interesting. The next time I'm going to talk about herniated discs in the neck, or the so-called cervical spine. Thank you and bye.